So hey everyone, good day to all. So it's just a small lecture, guys. So coming to the snake bite. Actually, in the FMGE exam and the NEET PG exam, how they are going to ask the questions is that, guys, it's very simple. Okay, just they will give to just give they will give to identify the what type of snake is this one and what is the cause of the death by this snake. Okay, and what are the how you are going to prevent from the snake bite. Okay, so if I talk with the only in with the exam purpose, guys, it's going to very simple. Okay, it's going to be I can complete it within 1 to 2 minutes. Okay, so first of all, our goal is that to know about the snake. See, actually, in the whole world, there are many snakes. There are around 3,500, 3,700 snakes, variety of snakes. But for our exam purpose, guys, we are going to know about there are two cases here. Okay, please read the question here. A patient is brought to the casualty. What is casualty? I think when we are abroad, we will say it's a ER, emergency department. Okay, in India, it's a casualty. Okay, a patient is brought to the casualty with a history of snake bite with features are shown here. Okay, during the course of treatment, the patient expires. Oh my God. The accused snake is bought by relatives as on the image. What will be the cause of death? See here. What can you identify the snake here? This is the snake. This is the death of the patient. Patient will having what? Ptosis here. Ptosis here. Okay, isn't it? This is the beaten side. Okay, so let's learn about this one. Okay, see here. Actually, we have to know about the two types of snakes. Okay, see, array yaar. Okay, the first one is the neurotoxic snake and the hematotoxic snake. These are belongs to Elapidae family. Okay, in Elapidae family, we are going to have the neurotoxic snakes. We having cobra, we having cobra, cobra, are naja naja. Next, kite. What is kite? First one, what? Cobra and the kite. Cobra. See, they will give this image and they are going to ask you what type of snake is this? Is it neurotoxic or hemotoxic? Then you have to mark. See the what is the special character? This is having the spects like here. This is a automa. This is having the binocular mark here. And the spectacles here. Okay. Spectacle marks here. So you have to identify this is the cobra. Okay. And the next one is the karaitra. See karait. See in Hindi it's a kala. Kala karait. Okay. Kala. There is a white bands here. There is a single or paid white bands here. So what is the most common cause of death in case of neurotoxic? It is the respiratory paralysis or arrest. Okay, can you tell me what is the cause of death here? What is the snake here? It's a kala karate. Okay, there is a white bands here, isn't it? Okay, so the snake is going to be the karate. Okay, so it is a neurotoxic snake. So the cause of death here is the respiratory paralysis or arrest here. Okay, so if the if you are caught with the if you are bitten with the neurotoxic snakes, you will get the severe pain and paralysis of the body. Okay, what is the first sign? Is going to be ptosis or the and the diplopia here. So this is what you have to remember from the neurotoxic snake. Okay, now coming to the hematotoxic snake here. There is a these belongs to the Viperidae family. Viperidae family. Examples what? The cell viper, saw-scaled viper. Okay, the most one important one is the Russell viper here. Okay, there is a diamond-shaped spots here. There is a V-shaped spots here. Okay, see how to remember this one, right? See this is the Russell viper. Russell viper. V for this is a viper. V for what? It's a vessels. Okay, what vessels? Obviously blood vessels. It means Russell vipers are vasculotoxic. What am I? Vasculotoxic. Vasculotoxic. Vascular means what? Obviously, it is going to be what? Hematotoxic or vasculotoxic. Okay, so if you see that one, the bitten side is always going to be, there is a hemorrhage and there is more bleeding. Okay, there is a bleeding all through the body. Okay, the first sign is the bleeding from the fang marks, and if you are going to put the IV line also, there is a more bleeding and blood in urine and a conjunctival hemorrhage also there. That is the what? Okay, that is the hematotoxic hematotoxic snake. It is the Russell viper. So I think you know how to identify the Russell viper also. Okay, so what is the most common cause of death here? It is the renal failure. It is renal failure. If you are not going to give the anti-snake venom, then within the few hours only, the patient may land up into what? Renal failure. Then you have to do the dialysis there. Okay, the patient may lose the life also. Next one is the Hydropidae. What am I? Hydropidae family. No, it's about the no need to remember the family. Just remember the snake. Okay, that is the what? Hydropidae. It is the myotoxic. What is the myotoxic? Okay, actually, actually this snake is not going to be this snake is not going to be more poisonous. But if you are bitten by this snake, guys, it means the whole muscles, all the 630, what, how many muscles are 641 muscles? No, 637 muscles. All these muscles going to be what? It's going to be what? Cramping. Okay, now so every your muscles will going to get the cramps, will get more pain. Okay, so that is the it means you are bitten with the myotoxic snake, that is a sea snake. Okay, clarity done. So these three snakes are enough to remember for the exam. Then what are the preventive measures you have to take? Okay, so suppose example, okay, let's see here. Suppose example, guys, in a village, okay, mostly in the village, suppose example, this man is got bitten by a snake. Okay, and some of them, guys, so this man is bitten by the snake, and some of them are in, I think you guys saw in many movies, they will just cut that area with the teeth. Okay, please do not try to cut with the teeth or suck the venom also. Okay, now, but don't try this one. It's only in the movies. Okay, do not tourniquet. Okay, do not see. But always clean with the water here. Clean with the water, and you have to always immobilize the limb. Suppose you are bitten with the there in the lower limb. So do not disturb lower limb. Do not disturb. Do not disturb. Because why? If you are going to move the lower limb, it means the venous may pass through the venous also. Lymphatic system. Lymphatics. There is subcutaneous lymphatics now. If it will goes to lymphatics now, it will directly goes to the heart, and there is a on the spot death may occur. That's why you have to immobilize the limb and then try to wrap a bandage here, a tourniquet there. Okay, wrap a bandage, not too tight. Always you have to the two finger admitting. Okay, where at the side just 2 centimeter above the bite side. Try to wrap a bandage here. Just please remember, do not wrap bandage not too tight. Why? Why they do it? Why we are doing the banding? Why we are applying the bandage here? Tell me. Why we are applying the bandage? Because we are applying the bandage to block the superficial lymphatics, to avoid the rapid absorption from the where lymphatics. So that's why we are what? Blocking the lymphatics. That's why we are wrapping the bandage to block that one. What happens if you're going to wrap too tightly? If you're going to wrap too tightly, then what happens? The arterial supply may be what? Blocked. Then there easily going to be what? Necrosis there. That's why do not tie too tightly. Okay. Then always you have to, with every 50 minutes, you have to remove that one and again tie. Remove that, again tie. Okay. That's one. And bring the patient to the hospital. Immediately will bring. Okay. So how you are going to know that? So patient will come to the casualty ER. Okay. Patient will come to the casualty. Okay. So after that, the doctor will go to that one and will check and perform the ABC. That is what? Check the airway, breathing, circulation. If the patient is stable, then ask the patient or attendant, did you saw that snake? Did you saw that snake? The patient will say, yes, doc, I saw. It's a cobra. Okay. It means what? You have to observe. Cobra means what? It is a neurotoxic. As you know that, okay, if cobra is going to cause the what? What is the complication? It causes the respiratory paralysis. That's why you have to perform the physical examination. You have to perform the lung function test. Okay, everything. So you have to, if the patient says that okay, this is the cobra, then you have to do the management in the clear cut way, as in the here. If the patient don't know whether the patient might get bite by cobra or what Russell viper or just a non-poison snake. Okay, see, if they don't know that, we have to identify. We have to identify. See, first of all, you have to see the fang marks here there. Okay, fang marks. See here. See, actually, if the snake is what bitten, if the person is bitten with the uh, poisonous snakes, right, there is a two fang. There is the two classical fang marks here. Okay, if the patient is bitten by with a non-poisonous snake, it means there is no classical fang marks. There is only scratches are present here. Okay, only the tooth only present here. There is no fang marks. This is how you have to identify this. It's going to be the fang. This is the poisonous or non-poisonous. Remember, for the kite, there is no specific fang marks. That's why, that's why, that's why in the casualty, guys, what happens now? See, whatever written in the textbook or in any PDF, guys, they are not going to follow, because we don't know whether the patient might bite with the poisonous or non-poisonous. That they are directly going to give the anti-snake venom. Immediately we have to give the anti-snake venom. Okay, see, first of all, what I said, you have to immobilization of the limb to prevent rapid absorption, okay? And then apply tourniquet to finger. Not too tight you have to apply. Okay, now the next one is do the what a ABC approach. Okay, airway, breathing, circulation. Take the brief history. Okay, then what happened, guys? Immediately take, okay, now immediately take the blood from the patient. Okay, see, and keep here. Take the blood and you have to do the 20 minutes coagulation test. Okay, 20 minutes coagulation test here. What happens in normally, if you take the blood and put in a here test tube here, please do not disturb it. If you put the blade here, guys, within 20 minutes, the blade must be what? Clot, isn't it? That's normal now. What happens if the patient is bitten with the hematotoxic snake, then the blade will not going to coagulate. Okay, the blood will not going to coagulate. It meaning what happens? Meaning, okay, the patient might caught with the what? Might caught with the Russell viper, isn't it? Because we'll get the coagulation test will is the blood is not clotting. Okay, and also how you are going to identify if the patient is caught by the what? Russell viper. It means what? There is a what? There is a hemorrhage. There is a bleeding from the site. There is hemorrhage also. Okay, by that way we have to identify. Okay, the patient is might be bite by the what? Russell viper. Okay, this is how you have to identify. Okay, then you have to send the everything. bleeding profile, AP, PT, PTT, fibrinogen levels, okay, RFT, LFT, okay, everything you have to send for the investigations. Okay, this one is I did this one. Okay, then immediately guys, you have to give the tetanus toxide. How much ml? 0.5 ml IM you have to give, and you have to give the antibiotics such as metronidazole or ceftriaxone you have to give to prevent the growth of anaerobic organisms. You can also do the Epsom salt mix with glycerin or there is a dressing, guys. Actually, this was done in the many cases in the case of the cellulitis. Okay, and guys, if there is a okay, so if there is a mild cases, guys, if there is like only the non-poison cases, okay, if there is a if you in the case of the neotoxic snake or viper, that's we can give the in the mild cases you have to give the 5 vials of the anti-snake venom. In the moderate 10 vials. In the severe case you have to give the 15 to 20 vials of the anti-snake venom. Anti-snake venom. Okay, so guys, please remember before giving the anti-snake venom, guys, you must have the hydrocortisone, okay, or adrenaline, or and also dexamethasone. Because why means what means the anti-snake venom and the anti-snake venom gas it may cause the allergic reaction. Okay, na? That's why you have to first of all you have to give the test dose. You have to give the test dose to the patient. Okay, so if there is no allergic reaction, there is no erythema, then you can transfuse within the you have to take the 5 vials, okay, 5 vials into the what 100 ml NS, and you have to infuse that one. Okay, okay, and I got it. So that's why, guys, we have to in your pocket, guys, in your bedside, you must have the adrenaline or hydrocortisone. Okay, in case of the allergy to the anti-snake venom, we have to give to the patient. And what if the patient might bite with what bitten with the neurotoxic snake? It means, guys, you have to give the what? You have to give the atropine and the neostigmine. Atropine and neostigmine will reverse the paralysis, guys. Reverse the respiratory paralysis. So patient we may not land up into the respiratory paralysis, and you have to respiratory paralysis, and you have to make sure that you have the mechanical ventilator also aside. Okay, because the patient may land up into the what respiratory failure, so you have to provide the mechanical support also. Okay, so for the hematotoxic, guys, you have to give the FFP, okay, fresh frozen plasma, and also the blood products you have to keep aside for that patient. This is how you are going to manage the patient. So actually, if the patient is bitten with the neurotoxic or hematotoxic gas, the symptoms may be developed within the 1 to 2 hours only. Okay, so that's how you have to manage the patient. Okay, so clean with the water, immobilize the limb, do not tourniquet. Okay, do not squeeze the wound, do not cut the wound and remove, do not suck with the mouth, do not tie ligate around the wound, do not apply any herbal paste over the wound. This is what you have to do. And guys, always remember, all snakes are not poisonous. All snakes are not poisonous. And remember, all snake bites are not lethal. All snake bites are not lethal. You have to, first of all, you have to tell to the patient, guys. Okay, first of all, you have to do the reassurance. You have to tell to the patient that, okay, please calm down, please calm down. Remember, all snakes are not poisonous, and all snake bite not not a lethal. Okay, you have to reassure the patient. You have to educate the patient. Okay, this is how you are going to manage the snake bite. Okay, so I think this is going to be very helpful session for you guys. So remember what you have to remember for the exam. Okay, how to identify the snake. What is the cause of the death? Okay, and what are the indications for the anti-snake venom? Okay, tell me what are the indication for the vascular or toxic snakes? Is the patient developing what? Bleeding from the fang mark, and there is a bleeding from all over the body. Okay, you have to give the ASV. In the neurologics, the patient may learn ptosis, diplopia, and there is a respiratory paralysis, difficulty in breathing also. These are the indications for the ASV. Okay, na? These are the indications for the ASV. So that's how they're going to ask the questions, and also they are going to ask the questions from here also on the why we have to tie, why we have to wrap a bandage not too tightly. Okay, not too tightly. From this also, guys, they are going to ask the questions. Okay, they're going to ask the questions from this one to 20 minutes. Okay, 20 minutes coagulation test, and they are going to ask the questions from this one, guys. If there is the patient is allergic to the ASP, then what you have to give? Adrenaline or hydrocortisone you have to give. And also they may give the questions around the why we are going to use the atropine and a neostigmine here. Okay, that's how. So guys, still in the actually in the exam purpose, guys, they are going to ask very, very, very simple questions. Okay, this is how they are going to ask. So remember the snake. I how you know how to do the snake identification, cause of death, and precautions. Okay, always. So for example, this is the road, guys. If you are walking on the roads, guys, please try to walk on the middle only. Okay, okay, middle mid set in while walking on the late nights. Okay, because the most of the snakes are what where at the corner of the road also. Okay, now remember, guys. One thing remember, guys. Remember one thing remember. Snake bite only mostly happens on where 6 a.m. to 6 a.m. to 6 a.m. to 8 a.m. and 6 p.m. to 6 p.m. to 8 p.m. Okay, snake bite will happens most probably this time only 6 a.m. to 8 a.m. 6 p.m. to 8 p.m. because this is the time they are going to what for something for their foods for this something for the exercises they are going to come outside. Okay, that's it, guys. So that's all for the snake bite. Okay. Thank you very much for the participating, guys. However, I'm going to post this one in the YouTube. Okay. Thank you very much. Tata, bye bye. If you're in doubts, please try to ask. Thank you.